Well, I was in year 11 at Cambridge High School, and I found that I was having probably about 3 out of 5 days at school, and that really wasn't enough. And so I found that I had a stint where I was in hospital for about 2 weeks, and everything was it was going to custard. And so I had a lady from the Northern Health School come and talk to me, and she said to me, "You're not going to be able to keep going back to school, you're not going to be able to achieve." And so that really sucked. It really hurt. And so I decided that, as a family, we decided that I should probably go into the correspondence school. And so I did that. And I got probably about 20-something credits out of it, maybe about 26 credits out of it. And still, I didn't get my 80 credits that I needed to pass level 1.
There are quite a lot of lost opportunities, stuff like I can attend the fun sort of days with my friends at school.
I wanted to achieve, and I love school. I love working, and I've got a great work ethic, and so I found that doing correspondence, not only was I really isolated, but I couldn't achieve, and I couldn't do my goals, and I couldn't live my life. And so I found that it really impacted my school education, and it still impacts it today, because I've missed out on a whole lot of things. I've missed out on all that level 1 work.
I actually had to end up giving up ballet just because it was too physically demanding. I couldn't actually go to the classes, and when I did, it caused a lot of back pain and pelvic pain.
We've had women who've had to leave their jobs, give up careers, who've been unable to have children, or have had long delays and difficulties experienced having children. The impact for some women has been absolutely huge. Some of them can't study, travel overseas for young women because they're not feeling well.
The diagnosis is sometimes really difficult, but typically it's someone who presents with abdominal pain. In women, it's more cyclical abdominal pain. In adolescents, it may be cyclical or non-cyclical, very non-specific. They just, some girls are rolling over in pain, doubled over, to others who just have mild, use a little bit of anti-inflammatory before my period. So it's very, very varying. Some people can present with constipation, rectal bleeding, change in the urinary symptoms, passing urine more frequently. And some women have anxiety and depression, and then you go back and look at their history and ask them about their periods, and then I have severe period pain or pain during intercourse.
Women with endometriosis are diagnosed in their 30s, and yet most had symptoms when they were teenagers. The struggle they had to be heard and understood at that age really comes through in conversations. We really do need to raise awareness and listen better to teenage girls to make sure that parents in particular take their concerns seriously. A lot of mums have had symptoms and are undiagnosed themselves, and a lot of teenage girls as a result can't get the support of their parents as well. So sometimes they phone me at Inside Endometriosis, and we can work together to work towards a diagnosis.
We're at the doctor's maybe once a week, sometimes twice a week. And our doctor was brilliant. He was a very kind, genuine man, but he was stumped. And it wasn't until we saw a paediatrician in Hamilton that we got a fairly firm diagnosis. Yeah, but that took about 1.5 years.
The initial assessment is based on history. It's a huge part of endometriosis is taking a good history from the patient. Often the clinical examination and investigations come back completely normal. We then look at medical management. As a general practitioner, our first option is medical management for 3 to 6 months, and if that fails, we then refer them on to a gynecologist for further medical and surgical intervention.
Generally, a patient would be referred in by a GP. We'll assess the patient by doing an examination and an ultrasound. This only points towards a diagnosis. It doesn't tell us whether a patient actually has endometriosis. But it would indicate that the patient needed further investigation. The ultimate gold standard for diagnosis is a laparoscopy. Now, laparoscopy is a procedure where a little tiny nick is made in the abdomen, a telescope is put in the abdomen, and we have a look around.
When it first started, I was told that I just had ovary problems, that my ovaries had cysts. And then from there, when it happened again, we went back into hospital, and I was told that there was nothing really wrong, that it was just in my head. And then that was a big blow. That just made me think that I was losing it. And then I went into hospital again, and I remember I got a gynecologist who said to me, 14-year-olds don't get endometriosis. And about 6 months later, after being in and out of hospital again, I had my first laparoscopy, and they found endometriosis everywhere. It was just, I was ridden with it.
I was diagnosed in 2010 through a laparoscopy, which is like a keyhole surgery. And it was after going through many ultrasounds, x-rays, but I had to get diagnosed through that operation because that's actually the only way you can get diagnosed. That was actually such a relief for me because I finally had a chance to kind of put a name to how I had been feeling, because with the pelvic pain and everything else, I wasn't just explaining to people, oh, I just have pelvic pain. I actually had a name for the condition, and it was the first question I asked when I had come out of the operating theatre. I just like to Mum, so do I have endometriosis? And she said yes, and so it was actually quite a relief for me.
We can help women connect with others, we can help improve their understanding of endometriosis, and we can help walk alongside them in that process so that they can feel not so alone when they're trying to be diagnosed and seeking treatment options.
You're beautiful.